Anatomy Demo 12.5 by Juretic. Hello fellow anatomists for the last time. Today we'll be taking a look at the blood flow through the lower limb. As always, we'll start with the aorta and trace through the split of the internal and external iliac here. The internal iliac, as we remember from our first dissection, gives rise to the inferior and superior gluteal arteries, and this plays an important part in the blood flow surrounding the hip. As we move on with the external iliac artery, we see our first name change after it crosses the inguinal ligament into the femoral triangle. Our first branch off the femoral is the deep femoral or femoral profundus artery. Similar to the upper limb, the deep femoral artery gives off the medial and lateral femoral circumflex arteries that wrap around the femur and anastomose with one another. Also off the deep femoral artery are four perforating arteries to supply the muscles of the posterior thigh. We've now reached our first anastomoses of the demo, which occurs at the hip joint. This includes the arteries with the navy blue star next to their name, the gluteals, femoral circumflexes, and the first perforating artery. While this anastomosis is present, it is important to note that this anastomosis would not be sufficient to supply the entire leg if an injury were to occur to the femoral artery. Moving on, the femoral artery moves down the leg through the adductor canal and the adductor magnus muscle, and once it emerges through the adductor hiatus, we have our next name change to the popliteal. This is aptly named as the artery moves through the popliteal fossa. Here is where we have our first pulse point, as we learned in IPA. Next, this gives off the anterior tibial artery and continues on as the posterior tibial artery. Before we move on to the lower limb, I want to quickly point out our geniculate anastomoses here with the teal star. The geniculate anastomoses receives contributions from the descending geniculate here off of the femoral artery, descending branch of the lateral femoral circumflex from the deep femoral artery, the superior and inferior branches of the medial and lateral geniculate arteries here from the popliteal, and lastly, the anterior tibial recurrent artery from the anterior tibial artery. Moving down the leg, we have our anterior tibial artery, which moves through the anterior compartment of the lower limb to supply blood to the muscles of the anterior compartment. This then crosses the ankle joint to become the dorsalis pedis artery, which is where we have our next pulse point. Lastly, we'll follow our posterior tibial artery, which gives off the fibular artery that supplies the lateral compartment. The posterior tibial artery then continues on to supply the posterior compartments of the lower limb and is our final pulse point, which can best be felt behind the medial malleolus.